Connor Terrace, and I'm the Ontario Liberal candidate for Toronto Danforth. I'm joined today with Marilyn, she's a patient. She commutes to Toronto to see her family doctor. I've got Dr. Venugopal, who's an emergency room doctor at 3 hospitals here in Toronto. And I've got Bonnie Crombie, who's your Ontario Liberal Party leader. And Dr. Samji, to the left of Bonnie here. Today, I'm here to talk a little bit about, the doors that I've been knocking on over the last couple weeks. I've knocked on thousands of doors, talked to thousands of people, and healthcare comes up time and time again. One of those doors that I knocked on was a low-income senior who recently got heart surgery. He's alone, he has no home care, and he has no family doctor. And that's the Ontario that we live in. And so with that being said, I'm going to pass it off to Marilyn to say a few stories for you.
Good morning. Talk about my mother. She was 100 years old, and this during the pandemic. She fell and fractured her rib in 3 places, or her hip, sorry. And the care that she received was less than it should have been. After 90 days in the hospital, on the 91st day, they said they were releasing her, which they did do, and sent her to a long-term care facility, which was terrible. Her hip had not healed, and by this time she had fluid in her lungs, so she was susceptible to pneumonia. She subsequently passed away after 2 months in the nursing home. I tried to get her back into the hospital. They said they didn't have a bed and she had to stay where she was. And I also couldn't get her moved to a better nursing home because she would then go to the bottom of the list. And being 100 years old, that wasn't a practical thing to do. She probably wouldn't have lived through it. And as it turned out, she passed away on Thanksgiving morning because of this. And I also had somebody at home at that time who needed care. There was no care available. I had to take care of somebody who had had a leg amputated, and I am not in the medical field. They sent a nurse over to show me how to do things, and I did it. And then he had to have rectal cancer surgery, and I had to take care of him when he came home from having that as well, with a stoma. And it was really terrible. Not having health care come each day to help with him. And he passed away as well in February of 2023. And so something needs to be done. Thank you.
And then we're going to have Dr. Venugopal here share a few stories as well and his remarks.
Great, thank you. Good morning to Leader Crombie and MPP Dr. Shamji, who I have a great degree of respect for both of them. My name is Dr. Raghu Venugopal. I'm an emergency doctor in 3 Toronto hospitals, and it is my grim duty to report to the public this morning the tragedy that is happening in emergency departments across Ontario. It is also my duty to call upon Ontarians to have hope that we can have something better. What I want to start with is Premier Ford's promise in 2018 to end hallway health care. Unfortunately, the situation has deteriorated from 2018. Not only has hallway health care been institutionalized, we have degraded from hallway health care into standing at the nursing station health care and now chair health care. Before you today are stories of actual Ontarians, and I want to share with you, I want to give voice to the peoples whose voice is not here today, who are being cared in Ontario's emergency room chairs. The following cases are all true. I have not concocted these cases for you today. These are cases that came up contemporaneously between my colleagues and myself, to our great shock and dismay. The following patients are being treated in Ontario ER chairs. An unfortunate mother actively having a miscarriage, treated in an ER chair. A palliative care patient with cancer riddling his bones and with pain, treated in an ER chair. A patient after surgery with complications, with their abdomen open, treated in an ER chair. A patient with a rapid electrical disturbance of their heart called atrial fibrillation, whose vital signs are deteriorating, who is needing oxygen, and who needs to have their heart shocked under a monitor, treated in an ER chair. I want to tell you about a confused elderly man whose family has to hold him down to prevent him from running out of the ER, treated in an ER chair. I want to tell you about a man with a viral infection, with his whole family having COVID, sitting beside nursing home patients and cancer patients, treated in an ER chair. An elderly patient with a painful bowel obstruction, writhing in pain, treated in an ER chair. An elderly patient with bleeding in her brain, treated in an ER chair. An elderly patient with a broken spine, treated in an ER chair. A patient with the most serious form of a heart attack, called a STEMI, who has been accepted to be rushed to an angiography suite by lights and sirens paramedics, treated in an ER chair. A patient with a shoulder dislocation, which is very painful. A patient with an elbow dislocation, which is very painful, treated in an ER chair. A patient who just had brain surgery for cancer and now can't talk and can't walk, treated in an ER chair. And lastly, a patient with a new brain cancer who can't walk without assistance, treated in an ER chair. These are not exaggerations. This is what has happened under Premier Ford's watch in the current administration. The last story I want to leave you with is my patient. My patient sat in an ER chair for 40 hours. 40 hours. And I challenge anyone here today who is healthy and not injured and not sick or in distress to sit in an ER chair or any chair for 40 hours. What I want to talk about right now is the crisis in Ontario healthcare that I hope we can solve together. Because of ER overcrowding across our great province today, we have senior citizens whose soiled undergarments are being changed in open hallways. I am not exaggerating. This is what is happening in our great province. We have patients who are on EMS stretchers, who have been seen by the doctor, whose tests and treatments have been ordered. But because they're stuck on an EMS stretcher and there's no room in the ER because of overcrowding, that patient stays. And they stay for hours and hours and hours. And what happens to someone when they're on a paramedic stretcher for hours and hours and hours? And these are true stories. They are rushed into the emergency room when they lose their vital signs. The nurses and physicians do heroic efforts to try and save that patient's life, but that patient is dead. And these are real stories. And these are stories that we don't hear in the news every day, but this is happening in our province. The second point I want to make this morning is that we are having far too many emergency rooms that are simply closed. Let's look from 2006 to 2022. There was one ER closure in the province of Ontario from 2006 to 2022. Fast forward to 2023, and the Auditor General reported there were 203 ER closures in the province of Ontario. Fast forward again to 2024 last year, it was the record number of ER closures we've had since we were a province. The reality is that we have not listened. Premier Ford has not listened to nurses. He has not listened to hospitals. He has not met the need. And many of my patients, and Dr. Shamji as an ER doctor will agree, many of my patients can only wait seconds. Many of my patients can only wait minutes, and others can wait longer. But none of it makes sense if an ER is actually just closed. The last thing I want to say this morning is that my fellow Ontarians are waiting too long to see an ER doctor. Many patients, and this is publicly accessible, you can look on the web yourself. You can see the waiting times to see an ER doctor are 6 to 12 hours. But some patients we know wait far longer. And once you've seen an emergency doctor and it's agreed upon that you need to be admitted to hospital, the average time in Ontario to get that bed is 24 hours. 24 hours for an elderly patient, 24 hours with someone with dementia, 24 hours with someone who's injured. And in my experience with my patients, they are waiting up to 5 days on an ER stretcher waiting for a hospital bed. You know, Premier Ford in October, he gave a patient, a hypothetical patient called Little Johnny, a hard time for attending the ER with a potential broken knee and a laceration. And that's what we're here for. We're here for Little Johnny, who's got a broken knee and a laceration. But the reality is Ontarians don't have options. Ontarians don't have options of where to go to seek medical care. And so as an emergency doctor, as a trained resuscitationist, I am filling out ODSP food vouchers for my patients because they can't get them signed. And I am writing prescriptions because it's my duty to do so for people that can't see anyone else. I submit these stories to you in good faith as an Ontario ER doctor, and I conclude my remarks this morning by saying that I believe Doug Ford has failed Ontario ERs. I believe he has failed our publicly funded healthcare system, and I believe he has failed this great province. Thank you.
Thank you, Dr. Venugopal. Those were stories that, show just how broken our healthcare system is. And with that being said, I want to introduce our Ontario Liberal leader, Bonnie Crombie.
Well, Dr. Venugopal, thank you for sharing. Thank you for being so passionate today. We know that you care. And to Marilyn, I want to thank you for your stories, and there's many more like them right here in this room, and we're going to take some time afterwards and take a look at them. But you are the reason that we are here. You are the reason I'm running to be Premier, because our healthcare system has been destroyed by Doug Ford. There are people living and dying without the care that they need, because Doug Ford has the wrong priorities. He'd rather build a fantasy tunnel or a foreign-owned spa at Ontario Place or give back checks than invest in our healthcare system. Do you know he gave more money to the foreign-owned spa at Ontario Place than his plan calls for in investing in healthcare? Please take note of that. More money, $2.1 billion to a foreign spa at Ontario Place than the $1.4 billion he plans to put into our healthcare, and that is shameful. He said in 2018 he would end hallway medicine. He didn't get it done. We know that wait times are twice as bad as they were in 2018. And today, 2.5 million people don't have a family doctor, and there are hour-long waits in our ERs. Our frontline healthcare workers are so passionate. You saw how caring Dr. Venugopal is. They're resilient, they're dedicated, but they just don't have the resources that they need. And that's why we're here today, because I'm going to make a commitment right here, right now, to the fix for our healthcare system in Ontario. Number one, we invest in family doctors so that everyone across Ontario has a family doctor, and that, of course, will help alleviate the wait times and the pressure in our hospitals. Number two, we're going to invest in hiring more nurses and PSWs and paying them a living wage no matter where they work, so that they can go about and do the job that they love. And three, we're going to invest in our hospitals so that we can provide the care that is needed. We're going to grow the capacity, and it'll help our economy grow as well. That's my commitment to Ontario. That's what voting for an Ontario Liberal Party will do for you. You will have a family doctor, and we'll end hallway healthcare. That's our commitment when you vote for us. You vote for Dr. Shamji. This is our one pledge and commitment that within 4 years, we will ensure that you have a family doctor. Thank you for coming and joining with us today. I'm happy to take your questions, and then we're going to tour some of these very tragic situations that have occurred in our healthcare system in Ontario.
Thank you so much. If folks can line up over here, one question, one follow-up, and please state your name and outlet.
Hi there, it's Jessica from the Trillium. So I recall the 4 years when a previous Liberal government froze hospital funding. Was that a mistake?
As I recall, 23 hospitals were built in that time, but I'm looking forward, Jessica. I have a plan. I'm a different kind of leader. I have a different kind of commitment I'm making to solve this healthcare crisis that exists in Ontario today. We're going to ensure that every Ontarian has a family doctor, and it'll take stress off our hospitals, and we're going to fund our hospitals properly, and we're going to hire the nurses and the PSWs that are required.
To follow up on that, the NDP is out with some rapid response to this announcement this morning, blaming previous Liberal governments for hallway healthcare and quoting you saying during the early days of your leadership campaign that you thought the former governments had spent too much on healthcare. Do you regret those comments now?
Well, those comments are taken out of context. It was a plan that was going to be delivered by the federal government, and this is a party who doesn't have a serious plan. They're not focused on healthcare. We are focused on healthcare. If there's one pledge I'm making right here today is to ensure that everyone in Ontario has access to a family doctor, that we have the nurses and the PSWs that we need who are paid a living wage so they can do the jobs they love, and that we invest in our hospitals to build the capacity. That's our commitment. That's our pledge. The stories are around you. They are tragic and they are heartbreaking, and this is a failure of Doug Ford's Ontario.
Bonnie, Sean Jefford, CBC Toronto. Question for you about the PC leader's trip to Washington and his campaign tone, the way he is positioning himself. He seems to be decided that he's going to take on Donald Trump, that the U.S. president is his opponent. He's not mentioning you. He's not mentioning any of the other opposition leaders in this campaign. What do you make of that? And are you concerned that he just feels like the rest of the opposition leaders, yourself included, are irrelevant in this debate?
Well, as we well know, this was an unnecessary election because he has a majority government, and it should be here governing to fix a crisis like the crisis we're seeing in our healthcare system, where 2.5 million people don't have access to a family doctor, and they're lined up for hours or days in an emergency ward, getting treated in a chair, not even in a hallway, but on a chair. You know, he can pretend all he wants, speaking to empty audiences in Washington. He's running away from this election, which he called unnecessarily, creating a lot of instability, a lot of uncertainty. It is unnecessary and costing us $189 million that should be invested in our healthcare system. I hear it at the doors. Why are we in election? I said, you have a family doctor? Well, as a matter of fact, we don't. And I said, it's time for vote for change, because there's a change coming, and we are committing to you that you will have a family doctor. So you know what? At the end of the day, Sean, this is a time of crisis where we all need to be working together. We need a United Team Canada approach. There's no doubt about that. The Premier could have been preparing us for this day by investing in our economy, by protecting jobs, but the only job he wants to protect is his own, and that's exactly why he's doing what he's doing and where he is. There's not another Premier that would have called an election right now today.
And looking ahead to later this week, it's the Northern debate, your first opportunity to go head-to-head with the PC leader and the other opposition leaders. Yeah. What's the key issue to you, key Northern issue, I should say, that you want to zero in on in that debate?
Yeah. So for me, the issues are similar, paralleled all across this province, but I will say they're even more acute in the Northern communities, where fewer doctors are residing, and we're going to incentivize them to move up there. The wait times are even longer. So my priority will continue to be healthcare in this province, no matter where we host a debate or meet Ontarians. Thank you.
Hi, it's Chris Rishoe from the Toronto Star. A major issue is staff shortage. So how is any of what you're proposing going to get people back into the system or into the system faster? I mean, they can't be trained any faster. So where do you find the thousands of nurses and doctors that are needed?
Yeah. So let's start with the doctors for sure. As you well know, we're going to put $3 billion behind recruiting, attracting, training, and retraining doctors. We want them to come back to family medicine. We want to hold on to the ones we have, so we'll properly compensate them. Let's start there. We want to attract other doctors who have left family medicine for another discipline to come back. We know that quite a number are approaching retirement age, putting at risk another 3 million Ontarians. We want to ensure that they stay a little longer. Yes, we want to open up a couple more medical schools, and I recognize that's a longer term solution. So what we need to do is double the number of young doctors in our residency programs, bring in more foreign doctors to fill up those residency programs that exist in every other province but Ontario. We have half the number of residency spaces in Ontario than in other provinces, and our young people are going there. We need to bring foreign trained doctors into Ontario, into the residency program. How often have you heard that your friends or perhaps your own children went to study medicine abroad and can't get back here because there isn't a residency spot available for them? And then with foreign trained doctors and our kids, we need to get them through that mentorship program called the PRO, Practice Ready Ontario. We need to get 3,100 doctors in. We need to compensate them better. We need to incentivize them to move into the more remote communities, whether it's a multi-year service agreement or increased compensation or make an attractive package to them, to the nurses and the doctors, so that they do that. And let me not forget French-speaking doctors, because the Franco-Ontarian communities are very underserved right now as well. And you know, just because we're in the spirit of patriotism with everything going on south of the border, I'm offering an incentive to any doctor or nurse practicing on the other side of the border, maybe in upstate New York, maybe they're in Detroit in Michigan, or maybe they're in Buffalo. Come on back. We're going to give you, nurses or doctors, an incentive package to come back to home. They've been looking for that opportunity, and we're going to give it to them.
You did say that the Ford government has destroyed the healthcare system, and yet the party's still leading in the polls. So what do you think is going on there? Have you had a hard time getting healthcare on the agenda?
The only poll, we always say the only poll that matters is the one on election day. I'm really feeling the wind behind our sails. I'm really feeling the momentum. I think we're starting to break through. Quite frankly, people are distracted because they're struggling. They're working 2 and 3 jobs. You've got single moms who are trying to put food on the table. They can't pay their rent and their groceries in the same month. People aren't even paying attention. You know, what we do know is they've also spent hundreds of millions of dollars worth of advertising, talking about their plan and how great Ontario is. And it's not a great place to live right now. Jobs are leaving the province. The unemployment rate's the highest it's ever been. He's not protecting jobs, particularly not construction jobs or manufacturing jobs. They've left this province. You can't get a family doctor when you need one. You wait hours and hours in a hospital for care. You can't afford to buy a home. And you know, I ask people every day, is your life more affordable today than it was before Doug Ford was the premier? The answer is clearly no. So he is not fixing the basics for people, but they're busy. So I think that the last couple of weeks, you really see a lot of shift and a lot of momentum building as people start to realize, hey, we're in an election campaign, and I get that response at the door. Oh my gosh, why are we having an election right now? Nobody understands that. The Premier's trying to cling to power and outrun an RCMP investigation is the answer. So we need a change. We need a government who will put people first.
Hey, Bonnie, Barbara with QP.
Barbara?
How are you?
Morning.
I know you're talking about healthcare, but I actually wanted to ask you about education. So yesterday you announced a 10% cap on international students. I'm just wondering if you have a plan to make up for the loss of revenue from this decision, because from the federal cap that is already in place, there is already at $2 billion in lost revenue. And I think in 2023, the government were only able to make up just for international students alone, they make up $1.6 billion in extra revenue. So how How are you planning to, make up for these losses without raising taxes and also keeping the tuitions frozen, as you said?
Yeah, Barbara, thanks for the question. I had the opportunity to be out canvassing a couple nights ago with the teachers' unions, the public board and the Catholic board, and we're out knocking on doors because they know how committed I am to fixing our crumbling education system and ensuring that our classrooms aren't overcrowded and that we fix the repair backlog in our schools. They know how passionate we are. And you were there for our announcement yesterday when we committed to creating 40,000 jobs for our young people who are graduating, extend the time that they have to repay their OSAP, make it more available for them, lift the interest payment on the OSAP, increase the salary that they can make before they start repaying it. So a lot of great initiatives. And yes, we said we would cap foreign students at 10%. That's where it should be. That's where it should be. We've seen the effect of colleges, universities relying on foreign students because they're not being funded properly. So my priority will be to fund them properly. You're asking me how? There's $3 billion just given to people in pre-election checks, right? The Premier's amusing about a $200 billion fantasy tunnel under the 401 that won't ease congestion and won't be built for 40 years. That money needs to go into our healthcare system and our education system. He gave $2 billion, over $2 billion, to a foreign company to build a spa at Ontario Place, whereas the price of his healthcare package is about half of that. So his priority is giving away money to foreign companies and CEOs rather than fixing the healthcare crisis right here in Ontario. So the money exists, Barbara. We're going to prioritize it because, quite frankly, I think this government has the wrong priorities. They're investing in expediting the sale of beer and wine, bike lanes, big spas, and their rich friends. And need I remind you of the money wasted during the Greenbelt scandal that is being investigated by the RCMP, $8 billion. Thank you.
We're also heading to North Bay soon for a debate,
Yes.
and this is an area that relied heavily on international students to make ends meet, especially the Francophone colleges and institutions there.
Yeah.
I'm wondering what you have to say, to people in this area who might be scared of your proposal, and also you're talking a lot about, giving them proper funding, but it doesn't really seem that you have a figure in mind. So if you can elaborate on how much you're thinking and investing, and also, especially for the Francophone institutions, their mandate is to attract international students, right? So are they going to be capped as well?
So let's be honest. Doug Ford did this, bring in the foreign students and allow this to happen. It's unsustainable, and it's created kind of a Ponzi scheme, quite frankly. And it's time for that to end, and it's time for that to stop, and it's time to start funding our public institutions properly. What we do know is other provinces fund their colleges and universities' operating revenue to the level of about 60%. It's half that in Ontario, 30%. Why? I want to ensure that our children are trained for the jobs of tomorrow, hence why we're capping at 10%. That isn't sustainable. It's a drain on the resources here as well, housing, healthcare, etc. Let's take it back to levels that were manageable, and that's about 10%, and then fund the colleges properly.
In that government, you didn't serve in it. I respect that. But I'm just saying, for Ontarians who may remember what happened in 2018 with the hallway healthcare crisis, that were saying, why should they trust you?
Doug Ford has had 7 years to address that issue. The fewest number of beds, the lowest funding per capita in the country, 7 years. Do you trust that if you give him another mandate, that he'll do it in the next 4 when he hasn't addressed it to date? And the eve of an election call, he stood up and made a public health care announcement because it was the eve of an election. There haven't been healthcare announcements. He hasn't addressed the problem. I'm a different kind of leader. I have different priorities. You're quite right. I wasn't part of any of those governments. I was running a city. And I think I ran it pretty well based on discipline, fiscal responsibility, and never running a deficit, because the money we earned is the money we spent. And you know what I did? I put it to people's priorities. And in this case, the people's priorities is healthcare and getting them a family doctor and fixing the crisis that exists in our emergency room so that people aren't treated sitting on a chair in the emergency room.
Just to follow up from today's announcement, the release says you will pay all nurses and PSWs a living wage and ensure wage parity. What will nurses and PSWs earn under your plan, and how much has been budgeted?
Yeah, I've forgotten the exact number, but I think it's $35 an hour and $50 an hour. We'll clarify those numbers, but they'll have to be paid a living wage, and there has to be parity. It shouldn't matter where that nurse or where that PSW is employed. You know, whether they're in the community, in a long-term care facility, or in the hospital, there should be parity in their wages.
Hi, Bonnie. Sharif Hassan from the Canadian Press. My first question is that the Greens are releasing a fully costed platform today. Will you also do the same during your campaign?
Yes, we will be releasing a costed platform, and I understand that they too see the need and have adopted many of our recommendations on healthcare. I'm very pleased to see that.
And the next question I have for you is that in 2018, the Conservatives won a number of seats in historic Liberal ridings, including the Eglinton and Lawrence. I'm wondering if you have any specific or special plan to take some of those seats back, including...
Well, I have a secret weapon named Vince Gasparo in Eglinton Lawrence. And, you know, I have a great slate of candidates, a former Olympian, emergency room doctor. We have elected officials on our ballot, both at the school board trustees and municipal councillors. We have dedicated community leaders and community activists, business leaders. I can't believe the caliber of individual that has stepped forward. Thank you.
John McGrath, TVO. You mentioned expanding healthcare infrastructure. You mentioned particularly in the north. One of the hitches to expanding healthcare infrastructure in Ontario that's unique from other provinces is that we require municipalities to make capital contributions to large things like hospitals.
I know it well.
That's a policy that this government, the current government inherited. That was also the policy of the previous Liberal government. I'm wondering if you would put an end to that and whether that would be part of a costed platform.
And happy belated birthday. So yes, this is something I'm looking at because I know the impact that would have been to my city, frankly, Mississauga, and the impact that it was making on the municipal budget. And it doesn't allow municipalities, you know, to prioritize their own infrastructure needs. Instead, they're funding provincial infrastructure needs at the cost of the local taxpayer. When the city wants to invest in roads, bridges, and sewers and public transit, they don't have the ability to do that because they're subsidizing provincial priorities. And hospitals are a great thing, but we need the community to rally around and assist. But certainly this is up for review, and I think there may be plans for an announcement around that topic coming soon.
Thank you.
Thank you.
Okay, that now concludes our press conference. I do invite media up to take a bit of footage as well.
Thank you. Yeah, we're going to read some of these letters, and I encourage you to do so too. They're tragic and heartbreaking, and that is the reality in Ontario's healthcare system today.